Three.
Good morning, students. I am Dr. Anmol Kumar. I am going to handle the paper PGDMLD first semester paper histopathology and immunology. Today I am going to cover the topic overview of histopathology from the unit 1 introduction of histopathology and basic steps. In this video I will cover the basics of histopathology and what are its application in various fields. Then next I will cover the different types of specimen used for the histopathology laboratory. And the last section of my video I will cover the how to handle the specimen in the laboratory and what are the grossing experiment. So if you will see the term histopathology, it consists of three words: histoj, which means tissues, then pathoj means disease suffering, and the last word is the logia, it means the study of. It means that if you define the histopathology, it is a branch of pathology which deals with the disease in the tissue section. You can understand in such a way that if you are going to hospital, then doctor will collect the blood samples and they will do the analysis. Based on the blood sample analysis, they will diagnose some disease, whatever disease you are suffering from. So in that case, they are giving the blood samples. Here in histopathology laboratory, you have to give the tissue samples. Based on the tissue samples only, you will analyze the disease, which disease you are suffering from. So this is all about the histopathology definition. If you will see in this picture, there are two pictures are there. In the left side, the normal liver tissue, and right side it is the cancerous tissue. You can see normal liver tissue is all cells are arranged uniformly. While in case of cancerous, the tissue are not really well organized. It is not well differentiated. Somewhere it is more number of cells, somewhere there is no cells. So like that, you can compare the normal cells with the cancerous cells, and you can use this technology, histopathology technology, for the diagnosis of any disease. Next, I will explain what are the various scope of histopathology in the various field. In last slides, I already explained about the role of the histopathology. So here main role of the histopathology is in the clinical medicine, because based on the tissue section only, doctor will diagnose some disease, and based on this report of the tissue section, the doctor will give the drug, and after the treatment again they will take the tissue sample study and they will send for the histopathology lab, or they will do the analysis. So in this case it will also help in the to know the efficacy of any drug, how it's working or not. So another application is in the field of paleopathology. What does it mean? It means that it is study of any disease for the which occurred in the past, ancient age. Mostly you can take the example of infectious disease of leprosy, tuberculosis. These are the most common disease which has been prevalent in the past time. So usually this type of disease mostly affect the bones, and they will structure of the bones, and it will affect the joints also. So by comparing the bone histology, you can say that this infectious disease might be prevalent in the ancient age, correct? So another application of histopathology is in the field of forensic science. So this histopathology will help to investigate any crimes by observing the tissue section, right? And then you can also say it will also help to diagnose any disease belongs to the remote area, because if you sometimes the samples need to collect from the remote area like village, and there is no hospital, right? If you are giving any blood samples, what will happen? The blood sample may be destroyed. If DNA RNA sample may be destroyed, but in that case just you have to collect the tissue samples and you have to store in the formalin, and you can transport, because if you transport the tissue sample in the formalin, it will not destroy. In normal temperature also it will maintain, so it will help this in the diagnosis of remote samples. Next, it is also then you can say this is the most reliable techniques. How it is reliable techniques? Because in the tissue histopathology lab, mostly used to make the permanent slides. That permanent slides will not change after the year to year. Data cannot be manipulated. This is the beauty of the histopathology techniques. So you cannot manipulate the data. Whatever data you are seeing today, same data will be there after 1 year, 2 years of time. That's why it is most reliable. Next, last application I will discuss here, the retrospective study. What does it mean? If you are collecting a sample today, but we have no time, otherwise there is no resource person, there is no expert in the lab. So what you will do, just you collect the sample and store in the formalin. Whenever you want to study, you can study after 1 year, 2 years of time. Other option is there, just you make the block in the embedding medium and store it, and whenever you time you can study after 2 years. So like that you can study the same sample, the today collected sample, after 2 years, 3 years times. This is called the retrospective study. Next I will discuss about the types of specimen. Which type of specimen usually used is in the lab? Mostly there are 3 types of samples. So there are larger samples, then pieces of tissue, and the fluid samples. Larger sample mean you can use the whole organ or a part of organ for the study. So mostly you can use in this case is the large bowel sample, tonsil, or some uterus sample. So you need to remove by surgical procedure and you have sent for the study. But this is not mostly used. Most commonly used sample is the pieces of tissue. This tissue is called the biopsy. I will discuss about this one more in the incoming slides. Last type is the fluid sample. Fluid sample mean here you are collecting the body fluid like pleural fluids, and you can say the cerebrospinal fluids. These fluids sample can be used for the laboratory, but here you are not using the any histology section, because you are collecting the samples as a single cells, and just you making the smear on the glass slides, you are sending for the study, for the analysis purpose. So now I will speak about the biopsy. So this is the most commonly used sample in the histopathology laboratory. So it is a tissue specimen taken from the live organism. If you any tissue sample you are collecting from the any living organism, this is called the biopsy. Same thing, another similar word is there, autopsy. Autopsy means that if you are collecting the tissue from the dead body, this is called the autopsy. So don't confuse, both are different. Biopsy mean from the living organism, autopsy mean from the dead body. So in case of biopsy, the act of taking the tissue sample or tissue sample itself, both meaning are same. Both are called a biopsy only. So don't confuse. Both are same. Act of taking the blood tissue samples or tissue sample itself, both are same in case of a biopsy. The main purpose of the biopsy is to diagnose or to confirm the disease. Correct? So mostly by confirming a disease using biopsy sample is the histopathological study. Mostly you will do the histopathological study of the biopsy and you can do the analysis. Biopsy sample can be also used for the some other purpose like protein estimation also you can isolate, but most of the case we are doing the histopathological study in case of a biopsy sample. And this biopsy sample mostly used for the diagnosis of the cancer, and biopsy is the only you can say the only helpful in the diagnosis of cancer using the biopsy only. And in other disease also you can diagnose like peptic ulcer, hepatitis, kidney infection, all those things. But mostly we will use in the biopsy sample, the cancer diagnosis. Next I will discuss about the types of biopsy. There are several types of biopsy are there. So you can classify that biopsy type based on the which purpose you are using. What are the procedure to collection of the tissue sample, and how, it is soft tissue or hard tissue, depending upon to type different criteria. How you are differentiating the biopsy sample depends upon procedure, surgical or not surgical, soft tissue, hard tissue, depends. So we are not going to discuss about all types. We will discuss few which is most important in my next slides. So excisional or incisional, this is the most common type of the biopsy. Excisional mean you are collecting the whole tumor sample from the body, but in case of incisional you are collecting some part of the tumor from the body, right? If the tumor sample is very small, then you can use the excisional biopsy, but if tumor is very large, then you can't do the excisional. In that case you have to do only the incisional biopsy. And another thing is the excisional mostly done for the both diagnostic purpose as well as the therapeutic purpose, while excisional biopsy mostly done for the diagnostic purpose, right? And incisional biopsy also used when the lesion have the multiple if in case of multiple sampling, you need to collect the incisional biopsy only. if you see the picture, there are I explain here both excisional or incisional biopsy here. In incisional, you are collecting the whole tumor, while in excisional, you are collecting the some part of the tumor. Here, like another term also there, resection. In resection, you are collecting the whole organ from the body. This is called the resection. So that's all about the excisional and incisional. Now I will also discuss about the what are the procedure to differentiate different types of biopsy. What are the method to collection? So if you see the punch biopsy, this is the most common techniques using the, it is a punching type machine. So just you have to press and rotate, then tissue will come out, correct? Mostly in case of cancer, skin tissue or squamous cell carcinoma, we will use this type of punch biopsy. Next, it is the brush biopsy. Brush biopsy means there is a circular brush and you have to press and rotate. Then the light aberration is there and cells will come out and you can make a smear on the slides and you can send for the study. And last type is the curettage biopsy. In curettage biopsy, you use for the collection of the tissue from the uterus by using the scoop like surgical instrument. After the, just you scratch this scoop from the uterus and collect the sample. Next type is the core needle biopsy and the fine needle biopsy. In core needle biopsy, used for the collection of tissue, while fine needle biopsy used for the collection of liquid fluid samples. So this is a difference between the core needle and fine needle. Fine needle, usually there is a fine syringe and attached to the fine needle attached to the syringe, and you have to collecting the body fluid inside the body, correct? And last type is the endoscopic biopsy. In endoscopic biopsy, you are using the camera attached with the tube and collecting the sample from the stomach. This is called the endoscopic biopsy using the camera. And now you can also classify the biopsy based on the organ, mean from what is the source of the tissue, from which part you are collecting the tissue samples. So if you are collecting from breast, then you can say the breast biopsy. If you are collecting from the lung, then you can say the lung biopsy, depending upon the tissue to tissue organ, from which tissue organ you are collecting. So you can classify by source of the organ from where you are collected the tissue sample. Now I will come to the last section of my video, how to handle the tissue specimen. So this is the most important steps for the report analysis. If you are doing any mistake during the collecting the samples, then the report may be changed. So while collecting the sample, you should be very gentle. You should not press hardly to the tissue. Just you handle very carefully and don't press or squeeze. Just carefully you have to handle. And after collecting the samples, immediately you have to transfer to the liquid formalin. If you delay here, then autolysis of the tissue will start just after removal from the body. So here you should be very fast. After collecting the sample, immediately you have to transfer to the formalin. So it will not if you are doing very carefully here, so tissue sample will not destroy and all the morphology, all the structure will maintain here. Then the tissue sample will come to the lab. Then you have to do here the gross examination. Gross examination mean what? After the tissue sample coming from the hospital, you have to study inspect the tissue sample with your bare eye without using the microscope, because when you are collecting the samples, one leaflet must be attached with the tissue samples, right? And you have to cross check what are the detail mentioned in the leaflets. Mostly in the leaflets they will explain about the detail of the samples, like what are the source of the samples, what are the patient name, from where it is collected, in which condition the tissue was taken from the body. And another thing, they will also mention the structure of the tissue, what are the different color of the tissue while collection, and then what are the size, everything we will mention. Then you have to cross check whatever detail mentioned in the leaflets and actual sample you have in your hand, correct? If everything is fine, then you have to proceed for the next step of the tissue histopathology study. So if you see the pictures, there are one leaflet attached with the tissue sample where it is taken in the plastic container, right? And then you are, this leaflets contain all the details, and then you have taken out the tissue sample from the container, and you have studied, and you have seen then you have cross checked all the things with the tissue samples, and if everything is fine, then you are transferring to the tissue cassette for the next step of the histopathology processing. So this is the outline of the histopathology. What is going on in the histopathology laboratory. So in the today video lecture, I discuss about the biopsy and grossing. In my next video lecture, I will discuss about the different type of tissue processing steps. So from all the blue parts, from fixation to the block making, these are comes under the tissue processing steps. Then after the tissue processing steps, then we will move to the tissue sectioning, then mounting, staining and reporting. So these all are comes under the histopathology. So that's all about the today lecture. In the next lecture, I will meet about and we will discuss regarding the tissue fixation, what are the how the decalcification and what are the clearing, what are the embedding, and all those things I will discuss in the tissue processing steps. Thank you.